morning, everybody. Welcome to Archmaker, Dr.po Raval, 35 years as a board-certified physician. Today, we're going to talk about biomarkers. So for those who have heard about it, we're going to explain it. For those who haven't, it's a new word that is an offshoot of blood tests that are done to assess certain items. And those items nowadays are 6. They're usually done before and after whatever it is you're analyzing. So it's used a lot by professional athletes now, by professional trainers. It's also being used before and after for signs of inflammation, signs of rheumatic outbreaks. We get a baseline and then we do another bio assay in order to determine what just happened. So biomarkers, in a nutshell, are blood tests that are run. Specifically, there are about 500 different items that we look for. They are there for comprehensive knowledge on certain subjects. Those 6 subjects are nutrition, hydration status, muscle status, cardiovascular endurance, not just fitness, but endurance, injury risk, and inflammation. So I want to weed through some of this. Traditionally, physicians pull 2 different types of blood tests that are covered normally by insurance, and they tell us a lot about our overall health. One of those is called a CBC with diff. So that's a complete blood count with differential. This gives us everything about our white blood cells, our red blood cells, certain markers that would eventually indicate liver function, thyroid function, some inflammatory factors, etc. It's a huge test. If something comes up abnormal on that, we then take that and can pull a more specific test. We also have a test called the SMAC. You can order SMAC with X number of elements, and it is there to see overall health. One of the things in there is glucose and whether, to show whether you're diabetic, hemoglobin A1C, etc. This again is a huge test. It's anywhere from 10 to 20 different factors to further delineate what's going on. These are basic blood tests. However, they're now being called part of a biomarker. So what they do is you take all these elements and basically you're dividing them into what you're looking for. So if you're looking for nutrition, you're taking your glucose, your cholesterol, your fatty acids, your total protein, albumin, etc., out of these blood tests, blood urea nitrogen, another one, out of these blood tests, and saying this is your nutritional bioassay, meaning this is what your body looks like with their nutrition. Hydration status, all of us are drinking water, but is it actually affecting us, and is it actually helpful for us? So again, they're taking elements of this, these blood tests, and adding assays to this to see where our hydration is. It's a scientific approach to athleticism. Muscle status. Again, there are a lot of these things that we already pull, but there are 6 or 7 things that are now added to the bioassay to tell us better about what our muscle status is. Whether it's draining properly, what it's expelling, what actually is our muscle getting rid of, which might tell us something about how it's functioning. Blood urea nitrogen, again, is a part of this. Myoglobin is another one of these. There's several things that are specific to muscle status that are not part of a regular blood test. Next, cardiovascular endurance. So I will tell you right now that if you're seeing cardiologists or cardiac surgeons, they're pulling a lot of these tests, so don't pay extra for them. But putting it together becomes part of the bioassay, meaning we're looking at factors that affect the heart, but we're also looking at endurance and what is being expelled and what your levels are. Let's just take hemoglobin, which is part of a regular blood test. How does that factor in to cardiovascular endurance? Not just fitness, but endurance, what your muscles can actually do cardiovascularly. Injury risk. This is something that's very new. It is being used a lot in professional athletes. There are several items here other than cytokines. There are several that are not part of a regular blood test. We always check for bone density, and we do check many times for cytokines for certain tests. But there are other items in this that let us know what kind of risk you have for injury. Very important for a professional athlete. Lastly, inflammation and food allergies. So again, do not pay extra for these bioassays, because if we suspect something from a basic blood test that involves inflammation or inflammation of joints, we regularly send that to rheumatology. So rheumatology will run it, and you will be covered, hopefully, by your insurance. You don't have to pull a private bioassay. So basically, in a nutshell, a lot of what's being called a biomarker are just markers that are pulled up in a basic blood test that tell you about overall health. But there's certain categories that have a little bit more, like injury risk, muscle status, items that wouldn't be included in a basic blood test, and this is what people are paying for. There are currently 500 biomarkers, and you'll notice a lot of wellness experts are pulling up biomarkers and kind of altering what they do, and then they re-assay themselves 30 days later, 6 months later, a year later, to see if their regimen has worked. I hope this is helpful. It's a growing and new area, so sorry if it's vague. But basically, for right now, a lot of those biomarkers are part of your blood test, and that's where you want to start. And then after that, if you are a professional athlete, you're choosing to be one, or you want to know what to do further, you want to look for specialists that are biomarker or bioassay experts. So I hope that's helpful, and it's just the beginning of this industry.